Multimodality means obviously many different technologies to image the heart and the vessels. And I think over the past 10 years, things have improved so much that we have at least 4 different modalities to take a look at the heart. From the traditional ultrasound, which is non-invasive, just putting a transducer on the chest to be able to see the heart in real time, to nuclear imaging, where it's done most of the time, and stress testing. And then 2 newer ones are cardiac CT scan or a CAT scan, where we can see early calcifications of the heart and the arteries, but most importantly, we can see the arteries themselves, similar to the heart catheterization in the past, which is done completely non-invasively nowadays. And last but not least, very powerful also, is cardiac MRI, where you could see the heart, the structure, the function, and also where is a heart attack that has occurred in the past, where is it, how big is it, you can measure it, and that's for the first time we can see that. Each of the method is different. So for ultrasound, it's very portable technology. So you could take the ultrasound, you take it to the bedside. So if somebody is very sick in the emergency room or in the ICU, you could image the heart, see how well it's functioning, see the valves, if they're closing or opening well, and if they have a problem with them. Nuclear is you inject some nuclear material in the vein, and an individual would usually undergo a stress test, and then you could see how much blood is going to different regions of the heart. CAT scan is like an X-ray, and nowadays things have really improved because the X-ray amount has gone down significantly over the past 10 years, so much more safer. MRI, also completely non-invasive with just waves that are sent in a magnet to the heart. And it's interesting because of the water that is in the blood and in the heart that you could see the structure. It involves a lot of physics for us to be able to see it, but the images nowadays are just pristine, so beautiful, that tells you so much about the heart. Is it done? Believe it or not, nowadays, it is done from the early detection of any disease, the early calcifications in the arteries before anybody has any symptoms, to somebody who has a lot of symptoms, a lot of chest pain, a lot of shortness of breath that you wonder whether it's from the heart, to help diagnose the ailment, what the problem is, and at the same time, direct therapy, direct treatment as to what is the best treatment for that particular individual. If it is coronary disease, do you need a stent or other intervention or bypass surgery? If it is valve disease, what best to use in this situation? Medical therapy, some medications, or an intervention. And it also can guide the interventionalists, people who deal with what's called structural heart disease in the catheterization laboratory, to tell them where to put the catheter, how far to push the catheter, and when they release either a device or something like this, was it effective? Is it supposed to do what it's supposed to do? As exciting as the past was, recent past, the future is. It's really amazing of how much technology has evolved over the years. So nowadays, you can, in development are newer technologies for ultrasound to become as small as a smartphone device. So we can take a look at the heart in real time in a smartphone device. Also maybe listen to the heart at the same time, take an electrocardiogram, an EKG with that small device. And I think what it will do, it will empower the physician, the nurse practitioners to have much more diagnostic power, to be able to tell what's really going on with a patient at the bedside, wherever they are. So they could be at home, they could be in the office, they could be very sick in the hospital, in the ICU. I think that technology is really improving so much. And at the same time, all these technologies are telling us that how to guide us in management of patients. So it will tell the intervention, when to intervene on individuals. So all these new technologies, there's new PET scanning, so many other things that will give us a non-invasive look at the heart itself.